So, this book really opened my eyes to the massive effects trauma can have on early childhood brain development. I didn't realize that many psychological symptoms are so overlooked and physical symptoms are so overlooked when physical symptoms are shown because it is more treatable. A lot of doctors seem to overlook the importance of the mind and body connection. And so, in A Boy Who Raised as a Dog, Dr. Perry numerously mentions the fact that in medical school they teach you to treat the symptom rather than the underlying problem. This is particularly harmful to those that undergo trauma because they seem to be in a cycle of depression or anxiety because of the neglect of their true symptoms. On page 19, Dr. Perry discusses the brain system, in which he says the stress response systems are among only a handful of neural systems in the brain that, if poorly regulated or abnormal, can cause dysfunction in all of the four main brain areas. And in this, it is a great example of why it is so important to understand the mind-body connection, simply because history of childhood abuse can lead to an ongoing toxic stress response. And so throughout the novel, Laura's story in particular stood out to me the most because it was a salient example of what happens when mental health is ignored. On page 87, Dr. Perry says that the mind and body cannot be treated separately because it reveals what infants and young children need for healthy brain development and demonstrates how neglecting those needs can have a profound impact on every aspect of a child's growth. So in Laura's case, she went through months of exploratory surgery and painful procedures, and all of this was an attempt to try and figure out what was going on with her. And in reality, it was something that was going on in her brain, but it was overlooked because she had physical symptoms of the stunned growth and malnutrition, and she had to be injected with all these feeding tubes in order for her to get the food and nutrients that she needed. And they falsely diagnosed her with anorexia. Thinking that she might spit up her food or throw up her food when the parents weren't looking. And surprisingly, her mother, Virginia, the doctors had told her not to engage with Laura, but little did the doctors know that this actually caused more harm than good. So Dr. Perry discusses that responsive parenting is especially important because pleasure and human interactions are woven together. He says that children who don't get consistent physical affection of the chance to build loving bonds don't receive the pattern repetitive stimulation necessary to properly build the systems in the brain that connect reward, pleasure, and human interaction. And so afterwards, all it took was a little bit of love and comfort for Laura that allowed those neglected neural systems to resurface and grow. So Dr. Perry actually himself mentions in the book that he didn't realize this. And so when he talked to Mama P, and in her situation, she had a 7-year-old boy, and Dr. Perry suggested all these drugs to be thrown at him. And Mama P was like, no, you're not giving me any drugs for my child. I'm going to hold him, I'm going to keep him close, and that's all that he needs. He needs a little bit of love and comfort. And so Dr. Perry was so astounded by this. And when I was reading over this, I realized that is actually the case today. So a lot of doctors now, when you go to them and you perceive yourself to have some mental deficit or going through something very troubling, they're so quick to prescribe antidepressants and Zoloft, Xanax, Adderall. They're so tempted to give you these drugs so you can control your anxiety and control the ADHD or autistic behaviors that seem to be perceived, when in reality, all it takes is a little bit of background history on the patient to understand what they're really going through and what their past truly is in order to alleviate some of those actual causes rather than treating the symptoms. And so all it took was a little bit of love and comfort for Laura. So Virginia was ended up being taught by Mama P how to actually love your child. And it was very astounding to discover that Laura Virginia, because she was raised in a foster care environment, and she did have some positive impact from her foster parents. Because it was so inconsistent, she didn't know how to show Laura that she actually loved her. She gave her the basic necessities of home, food, shelter, changing the child, being there for the child, but she never actually took the time to hold the child and to love and nurture her in the way that she needed. Simply because Virginia never got that same experience. And so it was really interesting to discover that kind of repetitive pattern. And so I do find this super astonishing for me to read about Laura's case, because I myself want to become a doctor one day. In order for me to fully help my patients, I need to understand how the brain works and its response to the body. And again, like I said before, I do feel like a lot of doctors are actually ignorant of this fact. So the other story that stood out to me was Justin, the boy who was raised as a dog. I found it so mind-boggling how a young child was kept in a cage with dogs and raised to be like one. So much to the fact that on page 142, Dr. Perry says that Justin was allowed out of the cage, but when he didn't obey, back in the cage that he went. So it's interesting to read how neglected Justin was and how it had a profound effect on his development. His behavior resembled a dog's, and when he was undergoing tests, it revealed atrophy on the cerebral cortex and enlargement of fluid-filled ventricles in the center of the brain, and that his brain looked like of someone with advanced Alzheimer's disease, because his head circumference was so small that he was below the 2nd percentile for children of his age. This is on page 141. And so additionally, it was just crazy to read that many of the nurses and doctors did not know how to properly treat Justin, so his situation only grew worse. This actually corresponds with my point I made earlier, that it is important to understand the mind-body connection and how one can't be treated without the other. History of neglect in children can have a drastic effect on how they function both cognitively and physically. For Justin, he wasn't able to speak or walk, but he had a little bit of emotional connection because of the love and comfort he received with the dogs. It is very interesting to know how close one resonates with one another. And so for Justin, he grew up in the environment with dogs. And so he, being 6 years old, 6 years later, he kind of had that similar resemblance to acting like a dog and responding to what a dog does, because Arthur, his caregiver, was actually treating him like one. So the source of resilience and hope in this book was most exemplified, in my opinion, in Connor's case. He was this young high schooler with a history of childhood neglect, and that caused him to be emotionally distant from people. He had undergone months of therapy with Dr. Perry, and there have been times when his mother would call him frantic and upset that this treatment wasn't working. So Connor went through series of therapies, for instance, massage therapy to get him used to touch, music therapy to get him used to the idea of rhythms, because it was crucial, according to Dr. Perry, to have a rhythmatic system to follow, because it drives the pattern of development. This was on page 160. And so there were numerous times when Connor and his mother would give up, but it wasn't until Connor hugged his mom and told her that he loves her that hope began to illuminate. This case stood out to me as a story of resilience, because Connor had went through a lot as a child with being neglected without his mother knowing, like he was unintentionally neglected, and this had a profound effect on how he grew up, being 14 years old, and his mother feeling helpless must have felt so difficult and frustrating to undergo that, because she wanted to be there for her son, but unfortunately, because he didn't have that emotional connection that he needed in the first few months of his life, that had a profound effect on how he grew up and how he developed in the years to come. But the fact that they were actually able to overcome these troubles and rekindle their bond, it really showed how strong Connor and his mother were, and even the most neglected children have a bit of hope in coming back towards the positivity. I found it astounding when Connor's mother broke down and cried when Connor hugged her and said that he loved her, because that was just something he never had done before, because he was so emotionally distant, because he never got the emotional connection as a young child. So, to end this video, I want to talk about being an advocate for social change. So, in order to do that, I think it's important to educate others on the profound effects of neglect on childhood development, because it is so overlooked in today's society. I know in Kurdish culture particularly, mental health isn't seen as something important. It's seen as something, kind of embarrassing to have. That if you have depression or anxiety, they just tell you to get over it because you're just speaking false things. They don't think it's important. They think that if you're not physically sick, if you don't physically show your symptoms and aren't battling this like inner battle of what's going on inside your head, they think that you're just making all of this up. And unfortunately, although it is a little bit better in American culture, I still see the same things being said to people with mental deficits and mental cognition, who need help with their mental cognition, simply because it's seen as something so wrong in today's world. I do think it's important to have, these media platforms. We all have social media, being able to advocate on that, having panel discussions and speakers coming to talk, like professionals, maybe even like reading Dr. Perry's book on why it is so important to understand and talk to your patients and understand that you need to be there for your child. You need to be there for another human being, regardless of how old they are, because that emotional connection, that emotional integrity is super impactful for their brain development and connections that they hold with one another.